Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Jessica Sanders, nurse practitioner with Vitruvian Health Interventional Pain. She brings years of experience in pain management and has helped many patients regain function and hope. Today we're going to take a closer look at a revolutionary treatment for chronic low back pain, especially pain that comes from degenerative disc disease. It's called the Intracept procedure. And Jessica, before we talk about this treatment, please tell our listeners what exactly is this discogenic pain?
Discogenic pain comes from the degeneration of the spinal discs, which is the cushions between the vertebrae. I like to explain to the patients kind of your discs have become kind of like a flat tire in between there. It's not caused by a herniated disc or nerve root compression, but rather wear and tear changes. Often it is described as that deep, aching pain in the lower portion of your back. It is common in people aged 30 to 60, especially those with sedentary jobs and previous injuries or aging spines. It's often worse with sitting, bending or lifting can be difficult, and it's not always relieved by rest or exercise.
What are some of the more traditional options for treating discogenic pain?
Well, most patients try physical therapy first, and then, of course, pain medications come into play. Some people try the epidural steroid injections. These help temporarily, but they don't always treat the underlying source of the pain.
What is the Intracept procedure?
What the Intracept procedure is, it is a minimally invasive outpatient treatment for the vertebrogenic pain, which is a specific type of discogenic pain. This procedure targets a small nerve in the spine that's called the basovertebral nerve. This nerve transmits pain signals from those degenerated vertebral end plates. By using radiofrequency energy, we ablate or deactivate this nerve, disrupting the pain signal. The procedure takes about 60 to 90 minutes, and most patients go home the same day. There's no hardware, there's no fusion, and very low complication rates.
That's very good to hear. So, who is the ideal candidate for this procedure?
With this procedure, we're looking for people with that chronic low back pain, which means you've had the back pain for 6 months or greater. Pain has not responded to conservative treatment. There is a finding on the MRI that is called modic type 1 or type 2 changes. And what that is, it is an indication of inflammation near the vertebral end plates. So we are looking for that on your MRI to qualify for this procedure. We don't want to have any major nerve compression or spinal instability to qualify for this, and we do a full clinical workup and imaging review to determine candidacy.
What is the actual recovery process like, and how soon can patients feel relief?
Recovery is usually very quick. Most patients return to light-duty activities within a few days. Pain relief may begin within 2 weeks, but it is an ongoing thing. You may notice that improvement over, the following 3 to 6 months. Clinical trials do show that over 60% of patients experience 50% or more greater relief of their pain. Many reduce or stop using their pain medications altogether, and it is a durable solution. Relief often lasts for years.
Could you tell us a little about the Vitruvian Health Interventional Pain?
At Vitruvian Health Interventional Pain, our team specializes in interventional spine procedures, including the Intracept. We do have 4 locations across the North Georgia. We have a Dalton, Calhoun, Chatsworth, and Ringgold clinic. Each patient that we see gets a comprehensive diagnostic workup and individualized care plan. We collaborate with referring physicians, orthopedic surgeons, and physical therapists.
And before we close, what would you say to somebody who is living with daily back pain?
Chronic pain isn't always something that you just have to live with. If you have tried injections, therapy, or medications and you still struggle, please give us a call. And the Intracept can be a safe long-term solution that targets the true source of your vertebrogenic pain.
And Jessica, thank you very much for joining us again. I'm sure with this topic, a lot of people experience daily back pain, so it's been really good to learn more about it.
Yes, it's been my pleasure.
If you are in need of pain relief, you can make an appointment at Vitruvian Health Interventional Pain by calling 706-529-7124. More information is also at vitruvianhealth.com/pain.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.